Dr. Rohde, what is the difference between biofilms that develop in drains and then those that develop on surfaces?
Yeah, it's really an important distinction. And I know this might be getting into the weeds a little bit for the general public, but what Mark says is so critically important because that drain is typically in any place that's hydrated or wet is typically when you're going to be talking about that type of wet biofilm. That kind of makes sense, right? You would think it needs to be hydrated and has some moisture and it has the ability to maybe gain nutrients and so forth. But just as dangerous, and really more recently, research is showing this really kind of a more, even sometimes more dangerous issue with dry biofilms. And so dry biofilms are typically just what you might think they are. They're devoid of moisture. They can form on surfaces from high use areas like crib rails, like in a child's pediatric ICU, to bed rails, to devices, medical devices, to countertops. Just about anywhere that doesn't have a lot of moisture is where you see these dry biofilms. And unfortunately, and this is going to come up a couple of times in our talk, dry biofilms are showing even more of a problematic with resistance to some of these disinfectants and others. In fact, a lot of research shows that you almost have to mechanically remove these dry biofilms because they're so adhered to the surface and so difficult to remove. And, just to kind of throw this out there, you were mentioning, Michelle, how this kind of catches you off guard when you think about this. But healthcare associated infections are real. And that they've been a growing problem for over a decade or more now, antimicrobial resistance. And biofilms just amplify this problem because, again, these biofilms are so problematic. Once they form and they become mature, I want you to think about it's not just the disinfectant that can't get into the inner part of that biofilm to kill the bug. If it's in your body, like if it's adhering to a prosthetic, a knee, screws, devices in your feet, things like that, antibiotics can't penetrate that as well. So some people, unfortunately, end up having recurrent infections because the antibiotic, if you can imagine this is the surface and a little bit of biofilm, it will kill the topical parts because it can kind of get to that. But internal to that, it's almost like trench warfare. You can't get down into those micro communities. And then that nasty biofilm will seed. They're called persister cells, and they'll literally break loose and they'll go create another micro biofilm somewhere else. So it's just, it's tied to UTIs because of catheters. It's tied to IVs. So it is a huge problem beyond drains, and drains are big. And that's what we're here to talk about today. But it is a global problem within the healthcare setting.